child specialist practicing in Mumbai from last 5 years. I practice in Mumbai at two places, one at Parel at Jain Clinic and second at Shivaji Park Dadar at Park Clinic. You can contact me for appointments or consultation over there. Today's discussion will be a very practical topic which every parent deals with in their day-to-day life. That how do we identify whether our child has a worm infestation, yeah, has a worm infection or not. We are going to only talk about how as a parent we identify कि मेरे बच्चे को जंत या worms का problem है कि नहीं. Before going into that, I would like to give a little bit information about what are the different types. So there are basically 4 types of worm infestation or worms which happens in children as well as adult, but more common in children. They are the tapeworm, roundworm, pinworm, and hookworm. Okay. Now, the most common worm infestation etiology is a contaminated food. Okay, this becomes a very common source for getting a worm infestation. You usually don't get worm infection from airborne. Okay, you get either from a contaminated food, vegetable, or contaminated water, or contaminated vegetables, contaminated soil where the vegetable was grown. Okay, so the basic source of getting worm infestation, either you walk barefoot on a soil surface or on a sea, or you have eaten any raw vegetables or uncooked food, okay, or salads. So these are the ways through which your body can get the ingestion of worm. Okay, so basically different worm infestation can present with different kind of symptomatology, but I'm going to tell you some common presentations or signs and symptoms which are very common and should be looked off by the parents. See, the first most important thing is which and most important, a child only above the age of 2 years, okay, are more common. Child above the age of 2 years till the age of 15, 16, or adult is more prone for worm infestation. Child below 2 years are very less prone to worm infestation there, but it is less. So child are more prone for the worm infestation. So the first most important symptom or sign you have to observe is your child is eating well, okay, but still he is not gaining weight. Okay, तो खाना ठीक से खा रहा है बच्चा पर फिर भी वजन नहीं बढ़ रहा है. So this is the most important signs and you have symptoms you have to look for when if your child is eating properly still not gaining weight. This is one of the most important symptom. Second symptom is chronic or recurrent abdominal pain. बच्चा बार बार बोल रहा है कि मुझे पेट में दर्द है, पेट में दर्द है. You have done all routine investigation, sonography करा दिया, CT scan करा दिया, you gave symptomatic treatment also, still the pain is there. So mild abdominal pain, पेट में दर्द होना, that is one of the symptom. Okay. Now when your child has more of severe form of worm infestation, some children get anal itching, या मोशंस जहाँ से पास करते हैं एनस रेक्टम के वहाँ पे खुजली आता है, वो स्पेसिफिकली रात में या दिन में ज़्यादा आता है. फोर्थ सिम्टम कैन बी अ नॉक्चुरल कॉफ, या रात में खांसी आना, सूखा खांसी, ड्राई कॉफ. दिस इज वन ऑफ द सिम्टम. ओके, इन सीवियर फॉर्म ऑफ इन्फेस्टेशन जहाँ पे बच्चे को वर्म्स का बहुत सीवियर इन्फेक्शन है, सम चिल्ड्रन में गेट डायरिया एज वेल एज डिसेंट्री. डायरिया मतलब वाटरी स्टूल है, डिसेंट्री मतलब स्टूल्स मोशन उसका जो रहता है वो खून के साथ मिक्स होके आता है. सम चिल्ड्रन विल गेट फाउल स्मेलिंग स्टूल, मतलब जो उसका मोशन रहता है उसमें से बहुत ज़्यादा बदबू आता है. तो ये करने हैं बच्चों में जो हम लोग ये सब कारण हो सकते हैं. ओके, so we take up the first question. What are the early signs of worm infestation in kids? So see, majority of the times around 90 to 95% children doesn't have a clinical sign or symptom. Majority of the time it is only a routine. We do a routine stool test or we do a routine checkup. We come to know the child is anemic. Okay. सो मेनी टाइम्स और जो मेनी टाइम्स क्या होता है, बच्चों को सिम्टम आते ही नहीं है वर्म्स के, पर जिन बच्चों में जो मैंने अभी आपको साइंस एंड सिम्टम्स बोले, द मोस्ट इम्पॉर्टेंट, चाइल्ड इज नॉट गेनिंग वेट एज पर एज, खाना ठीक से खा रहा है, सब खाता है बरोबर, पर डॉक्टर वजन नहीं बढ़ रहा है, तो दिस द वर्म इन्फेस्टेशन शुड ऑलवेज बी रूल्ड आउट. Okay, this is one of the most important sign and symptom. Second is a dry cough. पेरेंट्स यूजुअली कफ रहता है तो ये करते हैं कि दे गिव कफ सिरप्स, दे गिव सम एंटीबायोटिक्स एंड, बट a dry cough can sometimes be also be because of a worm infestation. My 7-year-old child had a worm infection a month back. So what precautions should I take to prevent reinfection? See, there are certain do's and don'ts for prevention of worm infestation. First is a hand hygiene. Okay, hand hygiene is very important because your worm infestation you can get from your contaminated hands also. Now small children's, especially जो toddlers age group रहते हैं, वो बहुत जगह यहाँ वहाँ मिट्टी में हाथ लगाते हैं, घर पे यहाँ वहाँ हाथ लगाते हैं, वही हाथ से खाते हैं, so they can get the transmission through that. So proper hand hygiene is very important. Second is, don't give them raw salads or don't give them uncooked food. If you are giving them raw salads, make sure you are washing that vegetable or salad properly before giving them. Second is, though, if you are giving cooked food, it should be well cooked. It should not be half cooked or unripe. So these are the sources. Okay, तो ये आपको देखना है. And don't give when the child has just recently developed a worm infection and treated, avoid giving him raw vegetables, raw fruits for a month time. Okay, after that you can start, but do the following precautions: wash the vegetable properly, very nicely, before giving the vegetable. Either if you're giving salads, wash it properly, cook it in water and keep, and then give it. When you're giving vegetable, cook it properly. Okay, cooking kills 99.9% of the worms. Okay, now severe, what there are certain worm infections where there can be severe signs and symptoms. One of them is convulsions. There is a condition called as neurocysticercosis, where the worm which is entered into the body through our intestines, it goes into the bloodstream and it enters our brain. So such children can develop convulsions, या उनको बोलते फिट आना, तो बच्चों को फिट आ सकता है. दूसरा कॉमन प्रॉब्लम है सीवियर अनीमिया या खून की कमी. बच्चे का हीमोग्लोबिन 7, 8, 9 ये रेंज में रहेगा, तो देर विल बी अ क्रोनिक अनीमिया. Okay, acute blood. Now why does that blood loss occur? That worm, now the most common cause is a hookworm. वो worm जो रहता है वो सब intestine से खून चूस लेता है, तो because of that your body is not producing enough hemoglobin and there is blood loss. Because of intestinal damage, some patients may also have dysentery or bloody stools. So these are the severe signs of worm infestation for which you require very immediate medical care within within a day. Okay. Now, when suppose when your child is suffering from worm infestation, he is being diagnosed, he is having worm infestation. So the basic diet is, don't give him anything raw or uncooked. That is the first step. You can give any home cooked food, but don't give him raw vegetables, raw salads. That should be avoided. Okay. Certain foods like pomegranate. Pomegranate is very good for worm infestation, as pomegranates is considered as a vermifuge, which helps in killing of worms or helps in prevention of worms. So that can be added into the diet. Okay, that is one of the most important point. And other thing is, see, when now many times when we go out in restaurants we eat, So many times it is not always a possibility you're aware of the hygiene of the restaurants or wherever you're eating out. So make sure that whenever the patient has a history of eating outside food, कि आपके बच्चे ने लास्ट 7-8 डेज में बाहर का खाना खाया है, या उसके बाद से उसको पेट दुख रहा है, या some children may even get vomiting with worms. I forgot to mention that सीवियर केसेस में वॉमिटिंग भी होता है वर्म्स की वजह से. समटाइम्स द चिल्ड्रन में इवन पास वर्म्स इन स्टूल्स. आपको ऐसा वाइट वाइट थ्रेड जैसे धागे दिखेंगे. So this happens in severe infections. So always consult your pediatrician and get it addressed as early as possible. Okay. Now certain you should always remember as a take home messages. Okay, whenever your baby is going out or you are traveling with your baby, make sure whatever food you are carried is properly cooked or properly, especially water, because the majority source of infection is contaminated water or food. So make sure you are giving boiled. If it's a younger child of less than 5 years old, even if you are carrying mineral water, give a boiled water. Okay. Also, don't keep multiple handlers. Now what happens now, worm infestation is not just because of contaminated food and soil. Suppose in a family someone has worm infestation, and that person is the main feeding person in the family who feeds the child, so he can also transmit the worm infestation to the child. So whenever you have treating a patient in the family who has worm infestation, all the family members should be treated for worm infestation, including the children. सपोज कोई ग्रैंडफादर को घर में वर्म इन्फेस्टेशन डायग्नोस हो गया, उसने ट्रीटमेंट ले लिया, या ग्रैंड मदर को या मदर को या फादर को, so all rest of the family members should also be treated and deworming should be done as early as possible, so that they don't become carriers. Now what do you mean by carriers? कि बहुत बार क्या रहता है उनके, there are certain, now as it is a parasite it will lay eggs, so those eggs are always there in the intestine, and when the person passes stools, motion pass करता है तो वो eggs भी उसमें से निकलते हैं. Contaminated toilet seat, use of public toilets, okay, use of common toilets at school, these are sources of infection, especially for your pinworms or threadworms. हाँ, बच्चों को बहुत बार स्कूल में टॉयलेट्स यूज करना पड़ता है, तो ऑलवेज टीच देम, इफ दे आर लिटिल ओल्डर चिल्ड्रन, teach them that they should wash the commode seat and toilet seat properly before sitting and passing urine or stool. Okay, these are the various ways from where the patient can get a worm infestation. Now ideally every child above the age of 2 years should be done with deworming at least once in a year. If you are very prone to an endemic area, या you are residing in a rural area जहाँ पे आपको ओपन में बहुत चलना पड़ता है, एंड सॉइल्ड एरियाज में या एरियाज जहाँ पे बहुत स्लश होता है, ओके, स्लश मतलब बहुत कीचड़ होता है, और जहाँ पे बहुत कीचड़ मतलब शूज चप्पल पहन रहे फिर भी योर लेग्स गेट सॉइल्ड, ओके. So in those cases, in those areas, if you are residing, then we will advise you to deworm your child every 6 to 8 months. Okay, but this should always be done only after consulting your pediatrician or your family doctor. Okay, the most important message I would like to give is contamination usually spreads through your hands. Okay, when you are, if you are not maintaining a proper hand hygiene, through your foot. If you have walked barefoot, you have soiled your legs. Okay, okay. If you have soiled your legs, please wash. Please maintain a proper hand and foot hygiene, especially if you have a younger toddler at home whom you feed. Always make sure you, every time before feeding the child, you wash your hands properly before feeding the utensils, even the spoons and vatis which are using should be properly washed. Okay, so these are the ways you can contaminate and you can spread the infection, especially when you're giving vegetables. You can you make sure that you wash the vegetables very properly for 2 to 5 minutes. Don't wash it in a hurry. because many times the majority, like some vegetables are grown under the soil, like potato, onion. So that these are the certain ways where you can be grown in contaminated soil. Okay, so wash the vegetables properly, wash your hands properly, give the child boiled water. Okay, these are the takeaway messages from my side. And deworming once a year for your child. uh, so that's all. We'd like to conclude our session for today. If you'd like to connect with me, you can log in on BabyChakra on my profile, Dr. Sushil Jain, and you can connect with me via the link provided, and my mobile number is also provided at the BabyChakra app. Thank you so much. I would like to thank the whole BabyChakra team, including Nana, for giving me this opportunity to talk on this very common and interesting topic. Thank you so much. Namaskar.